Welcome to the Greene County Chamber of Commerce Lunch and Learn. Our guest today is Lawson. He's a benefits specialist at BOST Benefits. BOST Benefits has been a member of the chamber for quite a long time. We're going to go ahead and let Corey go ahead and take over then. Thank you.
Hello, everybody. Again, Corey Lawson with BOST Benefits. Thank you so much for having me today and taking the time. What I'm going to do for us is I'm going to share a little presentation with you all. I'm not going to be going over it quite the same way I would, in a group talking to folks. But I did want to kind of see what I show other people and give you guys an idea. I just got to get it here into presentation view. I think this is covering it. There we go. So what we've been doing a lot with folks, especially during the pandemic, is we've been doing a lot of these Medicare 101 sessions. And the real intent behind this is to bring people's education up from where it currently is on what they need to know about Medicare and the do's and the don'ts. Some topics that have been very hot, I would say, with folks lately is how it interacts with people's health insurance. A lot of folks want to know, hey, if I have group health insurance and I'm 65 and up, should I be going to Medicare? What do I need to do? I got a card in the mail. They just sent it to me. I didn't even ask for it. And then a lot of other people are asking, with COVID, what has happened with Medicare due to COVID? So to get started here, this is the PowerPoint that I use with folks. We have our little agenda here, like who is eligible, what are their coverage options, when are they allowed to enroll, what steps should they take when they know what they want to do, and obviously questions. Now, for most people, it's 65 and up that are eligible for Medicare. If you want the real definition, you actually are able to sign up for Medicare 3 months before your 65th birthday, the month of, and 3 months after. There are certain classes of folks, such as people under 65 with a qualifying disability or a person diagnosed with end-stage renal disease or ALS, that are also eligible for Medicare. Now, your coverage options in Medicare are what confuses most people, I would say. We kind of have an alphabet here, right? We have A, B, C, D, med subs. What does this all mean for employees and employers? Well, I'd like to tell everybody original Medicare is Part A and Part B, and that's the little red, white, and blue card most of us are familiar with. Part A, as the graphic shows you here, is for hospitals, and Part B is for doctors. I tell a lot of people, if you didn't realize it, you get two bills when you go to the hospital, one from the hospital itself and one from the physicians that you receive services from. Original Medicare Part A and B are covering, just the general things like what you would think your major medical health insurance does. They function very similarly. They have things like deductibles. You'll notice here that under cost, it says there's a $1,408 deductible in 2020 for being admitted to the hospital. So much like a regular health plan would have a deductible, right? And then it goes over its coverages, just like your normal major medical plan. They'll cover X amount of days at copays of such and such. It just depends on which major medical plan you are, and it changes year to year and from employer group to employer group. The nice thing with this A and B of Medicare here is they stay the same federally across the entire country. So these parts A and B here are going to be the same no matter where you go in the US. But again, like you can see here, even Part B, it doesn't have out-of-pocket maximums. There are 20% co-insurance on a lot of things. And right here, what I help a lot of folks with is you may pay a higher premium if you sign up after your initial enrollment period. There are a lot of parts of Medicare that have penalties associated with it if you don't do things on a certain timeline. And that's a really big part of what I do at these education sessions, is making sure people understand that. Now, what's not covered is just as important as what's covered. Like we said, the deductibles and co-insurances and excess charges, but another really big part for most people is the prescription drug coverage. And we'll get to that a little bit later, but that's Part D. Your major medical health insurance, as most people know it, your drug coverage is just included. It's not something separate that you have to worry about. There are not a lot of benefits for things such as hearing, vision, and dental under Medicare as well. And I would say that stands pretty true with your major medical as well, because you typically have a separate dental or vision policy. In Medicare, there are ways to get it all kind of wrapped up into one, but a lot of folks do have standalone dental and vision going into retirement. A lot of people might even try to port what their employer coverage was. And a really big point of contention for people here is long-term care is custodial care. that can be very, very expensive, and there are definitely some coverage gaps with Medicare and that type of service. So getting over to prescription drug plans, this is another thing where a person could get a penalty on. If you don't sign up for a prescription drug plan within 63 days of leaving employer coverage, or you just went to Medicare and never got one, they will penalize you when you go to sign up. Prescription drug plans are exactly what they sound like. They're helping pay for the cost of prescription drugs. Funny enough, the federal government says that you have to have Part D, but they do not offer Part D. It's only through private health insurers. And what is very key here, and I tell people, paying your Part B premium is almost like the key that unlocks Medicare. You have to be paying your Part B premium to have your Part D. So that is to say, someone that has Part B and stops paying for it, that physician serves as part of their healthcare, they're also going to lose their drug coverage as well. That might not be something everyone's aware of. So costs on prescription drug plans vary widely from plan to plan. What I tell most folks, it's very key here to know what a person is taking prescription-wise. That's another service I offer for people. I do drug reviews. I say, okay, what prescriptions are you on? Are you on the best drug plan for it? Do we need to switch you? And these plans change from year to year, quite dramatically sometimes, as a matter of fact. And what I really think hurts a lot of Medicare recipients is the amount of mail they're going to get. Their drug plan could change from year to year, and their drug provider will send them a notification, but they have 100 other things in their mailbox, and quite often these get thrown away. They think that they're, oh, it's just more spam, it's just more junk mail, I don't need this. So again, that's another kind of service I offer folks, an annual review to make sure. And really why we do that review is right here, the Part D formularies. These formularies change, and they determine what you're going to pay for a drug. And they usually have tiers, much like you're seeing this graphic here, tier 1, 2, 3, 4, and 5. 1 and 2s generally don't trigger deductibles or anything. These are very low cost drugs. 3, 4, and 5s are things like brand name drugs or specialty drugs or non-preferred generics, things like that. The other thing we educate people on is the Doughnut Hole. So you'll see that there is your annual deductible. Not all plans have it, but most do, I would say. And up to the first $4,000 in drug costs, you're good. Your coverage is pretty strong, but then you hit a donut hole, a gap. So between this $4,000 to $6,350 amount, you're going to be paying a little bit higher for your drugs, sometimes significantly so. However, after it reaches this amount, you're now in your catastrophic coverage. You could think of this like your max amount of pocket on your health plan. Unfortunately, it doesn't pick up all of the costs, but you pay a very small percentage or just a co-pay of your drugs. Our real goal is to not have people get here. We want to find 2020 cost sharing for Part D is kind of about to be obsolete because we're almost into 2021, but it's not changing a whole lot. These deductibles you see of $435 is pretty standard. There are plans with none or like maybe even $200, but they typically cost more. And this kind of just goes over in a little bit more detail about how the coverage gap works. Now, we went over Part A and B, that's federal government. We talked about how D is for private health insurers to offer drug coverage, and you need to get that. But there is kind of a nice little way to get around having all these different moving parts. For some people, we go to what's called Part C. And as you can see, it's Part A plus Part B plus Part D equals Part C. This is really nice because it kind of puts someone's Medicare needs all in one spot. Part A and B with their D, so their drug coverage is all in the same card. They're not pulling out a separate card along with their Medicare card. And they tend to have pretty strong drug coverage as well. In addition, a lot of these go above the additional benefits of original Medicare. So remember earlier we were talking about maybe dental and vision needs. A lot of these plans are going to actually include those types of benefits for folks, which is maybe the main attraction, I would say. But these are offered by private insurance companies, and something kind of key here is that, yeah, again, we have to be enrolled in Part A and Part B. We got to be paying our Part B premium. And these Part C plans do have service areas. It's based off your zip code. And this is kind of a good change with the global pandemic we're having right now. It says right here, must not have end-stage renal disease to have Medicare Advantage Part C. The main reason for this is there are usually specific plans for people. We call them special needs plans with end-stage renal disease, and their coverage tends to be very strong. So because of that, in the past, we had prohibited people with end-stage renal disease from signing up for Part C. However, going into the future, they are actually going to be eligible to sign up for Medicare Advantage plans, which is a nice change that has happened. Simply speaking, end-stage renal disease, a person under that might see a Part C plan that they really like, that they think would meet their needs, and in the past they weren't allowed to have it. And going forward in 2021, that is a change they made, so that's pretty significant. These plan premiums can change from year to year. Something interesting about these Part C plans, sometimes they don't have a cost, but the person is getting enhanced benefits, so that's very nice. But some of the, I would say, downfalls of this is that, you know, your coverage can be limited to a service area. So you have a network of doctors typically, you can't just go anywhere. And because your drug coverage is built into it, if for some reason your drugs change and this plan isn't working for you, you know, a lot of times you have to completely change the plan, even though you might like the other parts of it, because the drug coverage is such a significant thing for most people. There are a lot of different types of these Type C plans. What I tell people is these Part C plans are literally major medical for folks on Medicare. We have Hmos and Ppos, and if you're not real familiar with insurance language, HMO is a health maintenance organization. PPO is a preferred provider organization. Remember, we just kind of talked about special needs plans. They're for people with specific illnesses or conditions. These are acronyms that we do see in the major medical world, so most people are very comfortable when they're going to a type of plan like this. It makes sense to them. These other two down here aren't very common, a private fee-for-service and a medical savings account. I'm not really going to touch on them just because we really don't even have any of these in the area. So kind of the last option, remember at the beginning of our presentation here, we had A, B, C, and D, and then we had medical supplements. So medical supplements are a little bit different in that they're just going to be picking up the out-of-pocket costs that aren't covered on A and B of Medicare. These are actually what I recommend to folks because you might have noticed earlier in the presentation, we were talking about how there are not maximum out-of-pockets under A and B or Part D of Medicare. And that is probably the biggest change going to Medicare. People are used to having a maximum out-of-pocket. They're used to saying, oh, well, you know, the worst thing that could happen to me in a year is I spend $5,000 and then my health plan's maxed out and it'll pick up everything for me. In Medicare, you don't have that under Parts A and B or D. You can get a Part C and it will have a maximum out-of-pocket for your physicians and doctor services, but it still won't have one for Part D. And you know, you still have to hit that maximum out-of-pocket, which again, it could be $5,000 or maybe $6,000. These medical supplements here are actually just picking up what you as the beneficiary of Medicare would normally be paying. So as an example, we have different plan names, a whole nother alphabet, which confuses a lot of folks. But these plans are all standardized across the entire industry. And that is to say, Anthem's Plan G is the exact same as Aetna's Plan G and what it covers in regards to Medicare. These plans might vary in, you know, ancillary benefits, things like having silver sneakers, which lets a senior go to a gym for no cost, or maybe they have a nurse hotline. Those types of things may be different. But as far as what it's covering medically, like your deductibles and your copays, that's going to be the exact same. And these types of plans have eligibility. And again, we have to be enrolled in A and B, and we talked about that. That's like our key. We have to have A and B, and you got to be a resident and be in the area code and be 65 plus. But the really big thing here is that you have health questions a lot of times with medical supplements. And as a person who is 65 and up, it's much more likely that you fail this type of underwriting. So the other thing that we really aim to educate people on is that these medical supplements do have a guarantee issue period when you first become eligible for Medicare or when you're leaving group health insurance. So that's another thing we don't want people to miss out on, because take a person, for example, who has cancer, let's say, and they're going to Medicare, they could get a medical supplement that makes it where it basically pays for all of their treatment, and they don't have a deductible anymore, and they don't have to worry about a maximum out of pocket. But if they miss their chance to sign up without health questions, since they have cancer, they're probably not going to be able to get onto this. And that's another thing that I really help advise people on and make them aware of so they don't miss those opportunities. So this is a really nice graphic. I like to use this synopsis for everything we just went over. Original Medicare, Parts A and B. We got to have it, right? We have to have this. This unlocks everything else for us. But then we basically have two options. We can get a medical supplement, and we still have to get Part D. Remember, they say we have to get Part D, but we can get a med sup in Part D, and that kind of rounds us out. Or we can get Part C, which has that Part D built into it, right? So those are really our two options, and I think that this graphic really helps a lot of people understand the Medicare road. When can you enroll? We talked about this a little bit. Basically, when you're turning 65, right? That's when you're first allowed to enroll. But this is a really important part for a lot of people. What happens when you work past the age of 65? So we had a question from the audience that actually it was talking about how if I work right now, or maybe I have federal insurance, maybe I just have regular group health insurance, maybe I'm on a spouse's insurance, what is that going to mean for me going to Medicare? And what I tell people is just because you turn 65 does not mean that you have to take Medicare. Now, Part A doesn't cost you anything, and they're going to send you that automatically, so why not take it? Depending on how large of an employer you have, if you have an employer of less than 20 employees, Medicare actually has to be filed primary in most cases. So those folks usually do just switch over to Medicare because you don't want to have to pay for Medicare and group health insurance in most cases. For those people that have employers that are greater than 20, Medicare is allowed to be filed secondary. And there are instances in which it's better for you to stay on your group health plan, and there are cases which it's better to go to Medicare. I think the biggest differentiator for most people is cost. If they're an employer where they pay a decent amount of their health insurance premium, a lot of them tend to go to Medicare because with the supplement, Medicare health coverage is actually very good. I find that it usually rivals a lot of major medical plans, as long as a person doesn't have unique prescription drug needs. Now, the important thing here is you are allowed to delay Medicare if you don't think it's the option for you. Let's say your employer is great. They're paying for almost all your plan premium. You pay like $50 a month for your health insurance. Well, and it's good health insurance and you like it. Well, you might want to stay there, and that's absolutely fine. You can actually continue your major medical coverage and avoid all the penalties I was talking about earlier as long as you maintain that coverage. Now, as soon as that coverage ends, you need to start figuring out what you want with Medicare. And a lot of times, you know, I help people make those types of plans even before they get there, right? They say, hey, Corey, I'm not retiring yet. I just want to get a look at it. And since my consultations don't cost anything, a lot of people like to take advantage of that. And it makes them feel very comfortable. A lot of HR departments in the area tend to use us for that, just to kind of advise with Medicare. This is kind of going over again, like the fewer than 20 employees, what that means, but we kind of talked about it. Now, this is very important because this is kind of where we're at right now. AEP happens from October 15th to December 7th. Anyone that does Medicare is getting ready for AEP. It's a very busy time of the year for us, and it's very important because this is when all the plan changes happen. There are a lot of rules and regulations, and this is really where the Greene County Chamber can help me, and I can hopefully help the Chamber. I am not allowed to go out and tell people about all this. I can't just walk up to Joe on the street and say, hey, Joe, do you know AEP is coming up? I'm a Medicare agent. I'd love to help you with it. I, by law, am not allowed to do that. That's an illegal solicitation on my part. What I am allowed to do is I'm allowed to hold these educational 101 sessions like I'm doing with you all, and people are allowed to contact me after. People with employer groups or HR staff tend to tell their employees, hey, Corey's who we use for that kind of stuff. You should reach out to him. As far as how that can help an employer and what that does for them, it takes some work off their plate. I tell people HR professionals do so much work already, or if you're just a business owner and you don't have HR, you know, people are going to come to you with these types of questions. I would say don't stress yourself out with them. Have a good resource like me to do that for you. And we can always talk about like legal aspects of advising someone on something that you're not familiar with. So I say, you know, get rid of all those headaches and shoot them over to me, and I can just kind of get that taken care of. Another benefit to this is, you know, sometimes they're getting better health insurance, but you know, with employer groups, a really big thing that they look at every year is their health insurance renewal. Now, these folks that are 65 and up tend to utilize health insurance very heavily. And if the health plan that they're not currently on with their employer, if it's not meeting all of those needs as well as Medicare would, why wouldn't we want to switch them over to Medicare? It's going to be good for the employer group because now that's going to help their claims experience. It's good for the employee because now they have better health care, and they're probably going to be happier at work. It's very unfortunate, but you know, for a lot of employers, when an employee has a bad experience with their health insurance, they tend to blame the employer when really that blame might not be placed where it should be. They might have just not had enough of an understanding of their health insurance. They might have gone out of network, or you know, it could just be that health insurance has just gotten more expensive over the years for most people just because of what we've seen. So that's another big use for Medicare here. You know, it's an underutilized resource, I find, just because people are too nervous to go to it because they don't understand much about it. Now, the next steps, what I show people, you know, we go over their enrollment periods, we research their options because each person's different, let them ask questions. I feel like it's really important to make your clients feel comfortable and that they understand what we're doing. And then the enrollment process, I also aid them through. I mean, I'm really an A to Z person. I help them do all of this. And then hopefully they let me do a yearly review with them. You know, I can't make anyone do those, but I think I strongly urge it to my clients that you do a yearly review. Now, this is our contact info here. This is the office phone number. Zane and I are the Medicare specialists in the area for BOST. You could feel free to reach out to either one of us. I will say he works more the Waynesboro area and Augusta area, and I'm more like kind of the Charlottesville, Greene area. But that is really my 101 presentation that I give to most people. And I would say the other big thing here that's happened with COVID is that a lot of these Medicare Advantage plans and a lot of Medicare have started covering things like testing. So if you're an at-risk person and you want COVID testing, a lot of times they'll pay for it, or, you know, any COVID-related treatments, they end up covering it. A lot of the carriers are doing that. Not all of them are, but most of them are, and that's, again, something I can advise the person on, make sure they go to the right one. I'm trying to think if there's anything else important, but I think, Sherry, that's, I think, the meat and potatoes of everything.
Thank you so much, Corey. That was fantastic information. A lot of information.
Yeah.
Really good, and I like the way you laid it out and everything, and I appreciate it. And we look forward, for those of you who weren't able to join live, we're gonna post a video of this, so you can feel free to share it with friends and family and coworkers. And we appreciate your time, Corey. Thank you so much.
Oh, there you go. Thank you for your time.